Hello, everyone. Welcome back to Peak Human. I'm Brian Sanders. Thanks for listening. Thanks for going back and starting at episode 1. So many great episodes. Thanks for sharing with a friend, giving us a review on iTunes or any other podcast app. Today, I'm talking to my friend, Dr. Marty Gorman. He is a man that will help you breathe better. How you breathe is so important to health. Taking in the oxygen through your nose properly is huge. I think people are starting to learn about this more and more. James Nestor has a great book called Breathe. This is getting out into the mainstream. And Dr. Gorman helps people change their entire face to allow them to breathe better. I've been seeing him for many months now. I'm expanding my palate. We are mechanically expanding my face, my palate, my dental arches to make my airways bigger, to fit all my teeth. Just like Weston Price found back in the day, the people who were raised on the natural diet had wide dental arches, could breathe through their nose, had fully formed palates, could fit all their teeth. And the opposite is happening in the modern day. I had all these teeth removed. I had braces growing up. It was a whole mess. My face became narrow, could not breathe through my nose. But now I'm trying to regain this function, trying to open my airways. It's a multi-year process. So worth it. This episode is so different from normal. It's really important, goes well beyond the food stuff, but still has a base in good nutrition, but well beyond the food component to how your jaw is shaped, what you can do about it if you don't have the wide dental arch that you should, and how you can work with Dr. Gorman, even if you're not in Los Angeles. So check this one out. Let me know what you think. Please enjoy this one with Dr. Marty Gorman. Hey, Dr. Marty Gorman, how's it going?
Hi, how are you? Thank you. Thank you so much for having me on your podcast today.
Absolutely. Yes, you're over in Los Angeles. I visited twice to work with you to get my palate expanded. If people haven't heard of that, it's a long process to get your jaw and your teeth. Maybe you tell us actually, get it back to how it's supposed to be, how our ancestors used to have a wide dental arch.
Correct. Yeah, so that's what you came to see me about. And I'm sure you're noticing it's been 4 or 5 months you've been in treatment. And I'm sure now when you floss, instead of everything being real tight, everything's loosening up.
Oh, yeah. Absolutely.
And you're packing food between your teeth. And you have to floss more often, which is really good for you anyway, get all that bacteria out. And it's great. But it's a fabulous process that grows the jaw bones, upper and lower. And when you do that, the nasal bone also grows because that's connected to your upper jaw. So if here's your upper jaw and here's your nasal bone, you can't breathe through your nose. Well, as we grow your upper, the nose just opens up, which is really cool. And the other trickle-down effect is by having larger jaws, your airways get larger at the same time. So every time you breathe, more oxygen is getting into your lungs. So it's really pretty cool. It's just fabulous. Everything changes.
This is huge. This is a huge thing. I'm going to try to frame it in a bigger sense because some people might be thinking, I don't need to do this. This doesn't pertain to me. This is giant. This is to do with sleep and getting good sleep, getting good air. I think people are waking up to this breath thing. You know, there's books, like there's a book Breath, right? There's
right here.
Yeah, there we go. There's people talking about sleep. Matthew Walker's becoming well-known, talking about how important sleep is. This is super important to the world. I think this is going to change people's health. We're going to get into a lot of topics, and I'm going to let you, tell us all the way back to the history of Weston Price and the current problems. But I just want to set it up of how important this is, how important it is to get good sleep. This is my problem. I got a lot of my health figured out, right? People know my journey, 9 years, changing my diet. And I was trying to focus on sleep, but my sleep wasn't restorative. It wasn't perfect. I have not been able to breathe through my nose for my whole life. I remember being a mouth breather growing up, and I remember my aunt would make fun of me. She'd make fun of me like, what are you, catching flies?
I'm the same exact way. My son would say to me, Dad, stop chewing with your mouth open. I finally put it together that I can't breathe through my nose. I have to breathe through my mouth while I eat.
There's another one. People were just making fun of me too at the Sapien Center. I got my people there and they're like, man, you're making noise while you're eating. I'm like, I can't breathe. I'm trying to
Right.
fix this. Sorry,
Right.
So I'm on my journey. I'm fixing this problem. Maybe it's going to take more. Some people have a deviated septum. That could be part of it. But if, like Dr. Gorman said, you need to have the wide dental arch that could widen the airways. I'm going to let him talk because there's so much going, but just talk about your history and talk about how big of a problem it is, that especially with sleep apnea and airway obstruction, that people don't even know it, right? There's so many people walking around with these problems. They think they're sleeping. They're not getting restorative sleep because of their
Correct.
airway.
Right. Well, my journey, I've been a dentist since 1976, but it was really about 28 years ago that everything changed to me. I was looking to see why a lot of the things, procedures we were taught in school and doing weren't working. So I ended up taking a program 28 years ago. It took 2.5 years going back and forth to San Francisco and Portland. I think it was 19 different times for 2 to 4 days at each clip. And it was called Bioesthetic dentistry. And what that did was it got us to line the jaws up, get the teeth where they belong, get the the TMJ in the right place, and everything to work correctly. And it was really amazing. We made an appliance that stabilized the jaw, and I started noticing that a lot of people says, I breathe so much better with this appliance in, and the TMJ is healing, and everything feels great, but I'm breathing and sleeping better. And I kind of stored that because that really wasn't on the track I was on. So I did that for a bunch of years, and over time, I realized that every time I treated one of these patients, I was basically curing TMJ 95% of the time with this appliance that lined up the lower jaw to the rest of your skull and the body, and neck issues would go away. It was really amazing. And then after a period of time, I figured out that literally every patient that I was treating with this form of dentistry and stabilizing them and getting their headache and facial pain to go away, they all had a small airway, because I bought a 3D machine and we would take a 3D of every patient and they had a small airway. So I started asking the patient, how are you sleeping? How are you breathing? He says, I don't sleep. I don't breathe great. I'm always tired, etc. So that's how we evolved into airway and got me where I am right now. And along that journey, just so I could gain as much knowledge as possible, I became a diplomat with the ASBA, and I became a diplomat with the American Academy of Dental Sleep Medicine. And no easy feat. A lot of work. You got to show, pass tests, have so many patients you treated successfully, etc. And that's where we are now. And I went from making, for sleep patients, a mandibular lower jaw advancement devices that would pull the tongue forward, open the airway, and people would sleep better. The problem was, a side effect of all that was TMJ, headache, and sore muscles. Well, vast majority of the patients had to begin with, so you were just throwing, gas into the fire. So I looked around and I finally found this doctor, Dr. David Singh, and he had developed these appliances that grew jaws, and they did not create more headache and facial pain and TMJ issues. And that's what I've evolved into. And that's basically what you're wearing, is one of those appliances. So it's been a 28-year journey to get here. And it's been really, really exciting because we've helped so many people.
All right, everyone. Sorry to interrupt. Just wanted to talk a bit about our Nose to Tail body care line. This stuff is amazing. It was so cool to be in person at KetoCon last weekend and see everyone try it for the first time, see how much they loved it. They were blown away. It's incredible. We have skin food, a moisturizing cream. We have deodorant. We have hair products. We have soap. We even have lip balm. This is all made from beef fat. This is animal-based body care like your ancestors used. You can get it at nosetotale.org. This is our featured product now. We do all the meat. We do the biltong. That's great. You can also get it at nosetotale.org. But I'm so proud of our body care and want to highlight it. We are all about using nose to tail products in your body, what you eat, and on your body, what you put on your skin. Your skin soaks it up. You don't want chemicals. You don't want aluminum. You don't want fake fragrances. What you want is good, healthy animal fats with a bit of essential oils to make them smell good. This hair food is incredible. The hair hold is so good. Just a bit of beeswax if you want a little bit of hold. Deodorant. Man, skin food soaks up into your skin. I've said enough. Get your own at nosethetail.org. Thanks for supporting us.
So, and along the way, we we found all about Weston Price and his work, and like I showed you, the James Nestor book on the breath book, and we have so many other books that we've come across. But really, the big one that is a big picture item is this one: Treat the Cause, Treat the Airway by Steven Lamberg, and it's really amazing what he did. And it makes so much sense what he did, and it's like I'm like angry at myself for not thinking of what he came up with because it makes so much sense. He's a TMJ airway dentist out of New York, and what he did was he went through all his patients' medical records, and he wrote down every disease and symptom his patients had in the records, and he came up and he found they had 173 different medical diseases. And what they did was then he categorized them into 19 different silos. And the first one was traditional screening stuff. Number 2 was cardiology. 3 was pulmonology. 4 is gastro. 5 is neurology. Psychology is 10. Ophthalmology is 13. Chronic pain is 14. And there's 19 of them. And each one corresponds to a chapter in the book. And he found that if you checked off 4 or more boxes, it meant you had a high probability that you had a sleep breathing disorder. And I have patients coming and check off 15 to 35 boxes. People are really, really, really sick, and they don't get how all these diseases, and doctors don't get how all these diseases are related to sleep and breathing and lack of oxygen. So what we do is then when the patient comes in and fills that form out, after a year of treatment, you'll go through the same thing, Brian. We give you back your same form, and we say, cross off the symptoms you don't have anymore. And all of a sudden, people are crossing off 5, 6, 7, 8, 10 symptoms. So they know where they came from. They know we've helped them. And I got that idea from when my son said it was Passover, like during COVID, like 3 years ago. And it was just we had a small family dinner. And that's what my son said to me. He goes, Dad, you don't chew with your mouth open anymore. Dad, you're not burping like you used to, etc. And then I realized, and my wife says, yeah, you don't do any of that stuff anymore. And then I realized that if I didn't know my symptoms were gone from growing my own jaws, patients wouldn't know either. So my own little personal story with my son, who's the one banging on me all the years with the mouth being open. That's the only way I could breathe. I could never breathe through my nose. And now I can breathe excellently through my nose. So it changes everything. I used to have a horrific postnasal drip, 98% gone. I mean, it's really changed my life. And when I have to start breathing through my mouth, it's so offensive because your mouth gets dry and sticky, and that causes all the bacteria to stay in your mouth. You get bad breath. You can get periodontal disease. You get more cavities if you breathe through your mouth. There are a ton of studies that show all these things. So it's been an amazing journey for me. And this work that we're doing now is amazing. And I'm so lucky because I have a team with me of 3. One's 36 years with me, one's 17 years, and one's 12. So they love what we do, and they're all smart. They're great. They're empathetic, and we just have I enjoy coming to the office. Where in the old days when you're just drilling a lot of teeth, it was a grind. And now it's just a joy to come to work every day.
That's so cool. And I can attest to that. Yes. I flew in just to see Dr. Gorman. I heard about him. I've heard some of his success stories, and it's been amazing working with him. So that's why I wanted to spread the word. This is so cool.
Thank you.
And you're starting from the root cause. That's another main thing that's the theme at Peak Human, right? All the doctors I interview, all the scientists, they're coming at it from the holistic approach and the root cause approach. It's the opposite of the normal way people do it, putting Band-Aids, all that stuff. You're doing that with the sleep and the airway. That is the root cause of, like you said, it could be 19 different types of disease.
Right. And I'm glad you brought that up. And that's the real beauty of what we do, whether it's myofunctional therapy. We learn to breathe through your nose, lip sealed, tongue to the roof of the mouth, teeth touching lightly, like you're right now. You can see your lips are sealed, you're breathing through your nose. I mean, that's what you should be doing. Your tongue should be up near the roof of your mouth.
Mm-hmm.
That's fabulous. And that's why myofunctional works at root cause. And then growing the jaws, again, works at root cause, because with the jaws larger, now the tongue really has room to stay up. And the flatter your palate, the better the chance the tongue can get up there. If your palate's really arched, well, the tongue just gets malformed to get to where it belongs. So you need a combination of both, but it directs completely at the root cause. And that's what we want to do. And that's fabulous. And that's what, Weston Price discovered over 100 years ago, the root cause. And it's sad how his work was pushed to the side by, traditional medicine and healthcare. And the same thing's happening today. I mean, here, I'm sure it's the same all over the United States. But I remember 30, 40 years ago when Kaiser came about, and it was this, health maintenance organization, HMO, and you had to go all the doctors and whatever, and everyone was complaining and yelling and screaming, you can't do this, you don't treat people correctly, blah, 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 blah. Now what it's evolved is all of healthcare basically is a Kaiser. They may have a UCLA label on it, they may have a Cedars-Sinai label on it, or USC, or whatever they, Texas Health, where you are.
Mm-hmm.
But the bottom line is Kaiser is in one building and all these other ones have little satellites. But it's still, this is how you treat. Everything's A, B, C, D, right down the list. There's no thinking involved anymore. And actually I was talking with a couple guys yesterday afternoon, and they were complaining about the same thing. They go to their doctor and the guy has 6 minutes with you. I mean, seriously? What can you figure out a root cause in 6 minutes? The only thing you can do in 6 minutes is say hello, take out your pen and write a script.
Yeah.
And treat a symptom. I mean, how many times you go to the doctor and they actually cure you, where they may, like you have an infection, they give you an antibiotic, you're cured. But you go in with high blood pressure or, diabetes, what do they here, take these pills. They're not curing anything.
Does nothing. Makes it worse sometimes because you just don't treat the problem, which is a lot of the diet and lifestyle.
It's all diet and lifestyle. I mean,
it's all diet and lifestyle.
There's an area of medicine called functional medicine, and there's naturopaths. But in functional medicine, the biggest mantra is food is medicine. And that goes right back to Weston Price. It's all Weston Price.
It's a legend. We should get more into, we got to get more into Weston Price. I just want to hit it one more time of how big an issue this is, because people don't know it. People, even if they're health conscious like me, I went through my life for years thinking I was doing it right, but I wouldn't wake up fully rested, even if I slept 8 hours. Or I talked to Dr. Gary. People know I used to do a lot of podcasts with Dr. Gary, who's in Los Angeles, who's right next to you. Uh-huh. He was saying he has like perfectly healthy 26-year-old dude, everything's great. Super bad sleep apnea. Had no idea. Super bad, like 35, 40, whatever events per hour. It was crazy.
Yeah.
So before we talk about Weston Price, set it up more. Like, how many people have these sleep problems and don't know it?
Oh, tens and tens and tens of millions. And there's the same thing with undiagnosed. I mean, I really believe when I look at the Lamberg questionnaire from the book, whether it's the adult one or the kids one, and you look at the symptoms listed on the 173 of them, kids is another 20, 25, 28, 30, whatever it is. And you look at it and you go, everyone has these. So I've become a firm believer in every single person, no matter how healthy they think they are, should fill out a real detailed sleep questionnaire like these and have a multi-night sleep test. These single night sleep tests are not really that accurate. And the more cases I do, we used to use a single night test. You know, we changed to a multi-night one about a year and a half ago. But if the patient had a good night's sleep on the first night and they came in with X score, and then you treat them for a year and you give them another sleep test and they have a bad night, there's no change. And the patient goes, I feel so much better. How could there be no change in the numbers? That's the problem. So now, like I said, with this 6-year-old, he took his test at UCLA at a half an event an hour. I give him a 3-night test, and on the middle night, he had 17 events. On anyone under 17 years of age that has 1 event an hour, it's a serious problem. He had 17.
So just to let people know, yeah, we talked about it before we started recording. You had a 6-year-old boy come
Right.
in. Yeah, they went to UCLA. They seem fine because they do the one-night test. It's like half an event. Oh, everything's good.
But how do you
Then you
explain
do the
all the yellow, all these symptoms the mother checked off? And then nothing gets, then they give him medication for all this stuff. No, sleep is critical. I mean, you have REM sleep is memory and memory consolidation. It's supposed to be roughly 25% of your sleep should be REM. And then you have deep sleep, and that should be another 25%. And the deep sleep is what gets you ready to bounce out of bed the next morning. So you're ready to take on the challenge of the day. Well, literally every patient, I've had like one patient in the last year and a half, 2 years that had good deep sleep. I mean, they'll have REM 15, 18. Some have 20, 25, but the deep is the killer. Nobody tests for good deep sleep. And that's why it's so important. And it's night after night. I give them a 3 or 4 night test, and it's the same thing night after night. Deep is either literally non-existent or very weak and poor. And you can't challenge. You wake up, you're tired. You sleep 8 hours, you keep wanting to sleep. It's not quality sleep. And then there are things in sleep tests that we find that medicine doesn't check for. It's like wake transitions. How many times a night is your brain waking up? Well, you could get out of bed, go to the bathroom, and you know you're awake. That's 1. And then maybe you turned over a couple of times, you realize it's now you're up to 3. And the test shows you has 15. The other 12 means your brain woke up. You didn't physically wake up, your brain's up. And every time your brain wakes up, you have to go through the sleep cycle again. Start with light sleep, and then hopefully get into REM within 90 minutes, and then you have your deep sleep. But you're spending all your time in light sleep because your brain's waking up and you have to keep going through the cycle again. And that's why REM is low and deep is poor, because the cycle never goes to, for more than, 30 minutes, and you're always recycling. And that's what's really bad. And we see it all the time. And then there are other things that we see on these multi-night sleep tests that are fabulous. It's something called the Sleep Apnea Index. And those are the events that are less than 10 seconds, because an event is 10 seconds or more with a 3% drop in oxygen. So what the SAI tells us is how many events you're having that are less than 10 seconds. I have people coming with 30 and 40 of them. Well, you add all that up, even if they're 5 seconds each, it's 15 more events. Oh, and the patient has 3 events, you're okay. And they don't even look at the events less than 10 seconds. So, and they can all be 9 seconds. That's not an event. But if it's 10 seconds, you got a problem. And well, it doesn't make any sense. But it takes decades for medicine to change. And that's what I love about what we do. And one of the reasons I became a dentist is when I see something that works and really makes sense, I'm evolving. I'm not waiting 10, 15, 20 years for the studies to come out. And I know it's against what medicine does, but hey, when you're looking for the root cause and trying to treat and cure people, you can't you have to evolve
You can't wait.
and change.
Well, that's the only doctors I interview, right? It's like the people who have gone against the grain, and sometimes it's hard. You could lose your license if you're not doing the prescribed things and getting them all the medications, and you're trying to recommend diet and lifestyle changes. You can go against these big boards, right, and lose your license, stuff like that. So yeah, Dr. Steven Len was another dentist I interviewed. If people want to go back and listen to that one, Dr. Joel Gould is another one. He's really into the vitamin D
Mm-hmm.
stuff. So Dr. Gorman will be my third dentist. And tell me more about the sleep test, because I used to when I first did a sleep test many years ago for a different reason, I had to go into this place and it was terrible. But now it's super easy and you can take home a little
Right,
device.
right. It's a big difference. And when it's a simple take-home device, they've gotten so much better in the last 4 or 5 years. Really, the evolution has been fabulous. The only time that I have a patient go to a sleep lab and take the test with I think it's 16 leads attached to your body and checking everything, is if someone on my test tests for central sleep apneas. And central sleep apnea is when your brain doesn't tell you to breathe. And that can be really dangerous. So I want to be 100% sure that that's what they have and that's the situation they're in. And then we send them out for a full PSG. And other than that, we stick with the 3-4 nights that we do with each patient. And it's really amazing. And, there's a handful of patients that literally they're almost the same, 5-10% variation over 3-4 nights. But the typical patient has about a 30% variation between all the nights. And according to studies, that's pretty standard. So when they have this 30% variation, and that's the problem with a one-night test. Like I said earlier, if it's the good night and, you're fine. And that's why I've evolved. And even with our post-op sleep tests and with our post-op 3D x-rays that show nasal airway passage growth and neck airway passage growth, head posture, any position changes the shape of the airway and the size of the airway. Your tongue being up to the roof of your mouth increases the size of the airway. If it's down a little bit, the airway got smaller. So if you happen to take the first picture and your tongue was up, your airway's larger, and then you come back a year later after treatment, for some reason your tongue's a little down, airway didn't change size or got smaller. And you're telling me I feel so much better, my symptoms are going away like crazy, I'm sleeping great, I have energy, my memory's improving, and the x-rays. So and there was actually a study just came out recently that talked about all that, about head posture, but tongue is huge too. And actually there's a chiropractor, Dr. Chris Chapman in Provo, Utah. He's an Atlas orthogonist. He works on C1, C2 basically. And he presented at a meeting I was at years ago, maybe 10, 12 years ago. And he showed a picture of the same patient. The first one, the head was down like this, and the airway measured front to back 6 millimeters. Then they had the same patient head up, airway measured 20, 25 millimeters. Then when the head in a neutral position where it belongs, the airway was 15 millimeters. So there's a gigantic change with head posture. And that's why most people, if you see people, if you have a crease in the base of their neck, a fold, that typically means, and I have that, they did this to breathe, the airway gets bigger, and then they come forward like this so they can see. And now look at my posture. How many people do you see like this?
Yeah. It's no good. Oh, everyone. That's like, the new
Yeah,
position.
exactly. And that means they've had a sleep issue
that,
their whole life. And now we have patients that they don't work out. They go for walks and things like that, but they don't go to the gym and, work on their posture or anything. And the postural changes that happen by themselves, because they can breathe now, their posture starts correcting. And we just see it in the profile pictures. It's amazing. how our brain just takes over and
It's
just helps us.
it's really cool. So in the intake, yeah, we took all the photos. That I did
Right.
that so that we could see how it was. And I remember you did some research on me. You watched some of my old podcasts, and I remember you told me that I was like lifting my head up to
Right, right,
breathe.
right, right.
And it
And
makes
that's
sense now. And now I notice it. I'm like, I can't breathe as well. And then now I have to live so I can actually try to breathe.
and it's really fun because the military stance, you're like this, your
Mm-hmm.
chin's back. Well, it's so
Mm-hmm.
much harder to breathe. I can't imagine how all these cadets and people in the army can be like this, and then out like gasping
Mm-hmm.
for air. And that's and I know when I do this, I can't get as much air in.
Mm-hmm.
And then as soon as I release, I get a full.
Mm-hmm.
Well, my posture personally has really, really, really improved over the last 3 to 5 years because of growing my jaws, oxygen, keeping my tongue up, lip seal. And that's one of the things that I dislike. I mean, you're drinking water off and on. I have my bottle.
Yeah.
So when we talk, we never take a break. Lip seal, breathe through the nose and go. We're just talking and we end up breathing through our mouth when we're talking, and everyone has water or vodka
Uh-huh. Some
to,
people, some
to
people.
moisten our mouths.
Yeah.
So,
But that's because yeah, that's what happens when you're doing it wrong. Well, you
correct.
have to talk. I mean, it makes sense, but that's just a indication of yeah, you get your mouth dry, you're breathing too much through your mouth.
Exactly. And chapped lips. I joke around with my patients. One of our goals is to, you know, put chapstick out of business. Because
Mm,
if you're breathing through your nose, your lips aren't going to chap and crack and be dry. That's one of the signs of mouth breathing is chapped lips and dry skin around on your lips. So, and then anyone that uses chapstick is a mouth breather.
yeah. Huh. It's a long process to change. I get why some people just want to do the easy solution, easy fix. I don't think there's an easy fix with this stuff. It's like you have to do the work. You have to do like big procedures. Like it's going to take me a couple of years to do this,
Right. It's going to take a
right?
couple of years to get the expansion finished. But I will tell you, Brian, that I filed a patent on a new product that
Mm,
is going to combine expansion and orthodontic treatment in one appliance.
mm,
So that's going to cut the time almost in half, number one. And the big thing with these appliances I have mine right here because they're plastic and they're thick. They're a little
hmm
tiny bit bulky. So most people just like to wear them when they sleep at night and they don't wear them during the day. So they only can advance the mechanism twice a month when you wear it only when you sleep. But if you had an appliance like that was really thin, like an Invisalign tray, they're
hmm
really thin, and you wear them 20 hours a day. Well, my design is very thin and it expands and moves the teeth. Well, now it's very thin, so now you can wear it 20 hours a day. So everyone's going to advancing 4 times a month instead of.
mm,
So now you get it half the time. You're finished
yeah.
with the jaw growth, and you can have the appliance specifically made that will only advance certain areas that you want to advance. So it's really you can advance everything grossly, or you can just say, let's do the small spot over here or over there, and
Wow.
so then you get the wear time goes up, and then if you can, and the appliance will also move the teeth and get them lined up while we're growing. So instead of being a year and after 2 years in growth and another year in Invisalign orthodontic treatment, now you're cutting that down minimally, at least in half the time, and it makes it
Wow.
less expensive too because it's less chair time. And and
Yeah.
and everyone will do more with it because it's quicker and it's not inconvenient, and they can speak with it. And when you put this in,
Wow.
everyone has a little bit of a lisp, and no one wants to have a lisp when they talk. So that's why you only wear it when they sleep. And anyway, so it's really cool. So there are advancements coming that are really going to change everything change what we do and everything. And I think it'll open more eyes and get more people seeing. And I think the biggest thing that you try to do and I try to do in my office is educate our patients, educate the people. This is why we're doing this. This is the thought process. This is Weston Price, and these are, and these, this is root cause, and this is why myofunctional works and things like that. And reaching out to the people is the most important thing. That's what your podcast does. That's what you do constantly. And that's what you do. And we're doing it basically one patient at a time. And, we do social media and things like that. And we have our website and all that. And the whole point of it is to educate the patients so they understand.
Yeah.
And vast majority of people, when they start listening and reading, they go, wow, this is every problem I have. So it's different than the medical model.
Well, it's so cool. That's why I want to have this podcast, because I've never heard of a podcast about palate expansion and this functional, dentistry type of stuff. So that's great. Just want to make sure people know what we're talking about. Yeah. If you only wear it at night, it actually grows your jaw, right? So that's how it works. It actually grows your jaw. So you're putting new bone into your jaw, but you have to put in the time. So it's like if you're only wearing it 8 hours a night, then you can only do so much growth. And that's why you're talking about if you could do it all day. Well, some people can. You can wear this appliance all day if you don't have to talk to people and interact with people.
Exactly.
Then it can go faster.
It worked really well on college kids during COVID, because everyone's on their computers. No class. All my college kids were wearing it 15, 16 hours a day, and they were done with treatments in 8 months. But yeah, it's the treatment, the way it works is there's like a screw that expands the plastic, and there are cuts in different places where you want the growth to be. But our head has 29 different bones, and they're all connected with sutures. And in the sutures, we find even in 90 or 100-year-old people, there are live stem cells, which is what allows us to do what we do. So when you put the pressure on the bone and these sutures open up a little teeny bit with each advancement, the stem cells become bone-forming cells, which are called osteoblasts, and that grows bone. And when you do it slowly at the biologic growth rate, which is why you have to wear it so many hours, you get really hard woven bone in the sutures, and you get a permanent result. The issue with rapid palatal expansion, where you have a device that's fixed in your mouth, and the parent is cranking it 3, 4, 5 times a day. The problem with that is it just the cells don't have a chance to form real bone, so you get scar tissue and sometimes cartilage, so it gets soft, so you get this collapse. Not fully, but you get a partial. I had back surgery a couple of years ago, and I didn't take my appliances to the hospital because I knew that I can tell how many patients I've had over the years that any appliance they had, whether it was a denture or an orthodontic appliance, never left. It disappeared. So I said, I didn't take mine, and I was in for 5 days. And when I got home, I put them in. The upper dropped right in, the low I had to turn the mechanism back a half a turn, which is like 0.09 millimeters, and it fit perfect. After 5 days of not wearing it, which means I've grown and I've been doing it slowly and I got real bone. And that's how you get a long-lasting result. But you still need the other root cause is the myofunctional therapy. You still need the tongue to be up on the palate to hold everything apart. So it's a combination. But yeah, it's amazing what we're able to do. And a lot of people say you can't do it because genetically can't do it. But we know that it's epigenetic, where, as we discussed earlier, our surroundings, the environment, everything Weston Price has said, didn't allow the genes to work correctly. The gene is still there. If it was genetic, we wouldn't be able to make the jaws larger. Here's some pictures of patients' upper and lower jaws. I mean, look at the size difference.
Oh wow. Yeah,
So I
I'll
mean,
put these on the
how can
website
you
or on
do that? Yeah,
Instagram.
but how can you do that if genetics says your jaw's supposed to be that first picture and you can't grow anymore? It's not. It's epigenetic. The environment has stopped us from the body doing what it's supposed to be doing for us.
Well, let's do the Western price stuff. This is so cool because I saw it firsthand when I went to Africa
Oh,
two
you
years
did?
ago.
Great.
I did. I went to Tanzania. I spent time with the Hadza and the Maasai and went to Uganda with the Pygmies. And I have video of these people, huge wide jaws, full dental
Yeah.
arches. They are getting proper nutrition. They're doing it correctly. And this is what Weston Price found. He found that when these people were living their natural lifestyle on their native
Right. And they
diets,
native diet.
super
And
healthy,
they were rich in,
wide dental
and like
arches,
you said,
no
right. And
cavities.
you said earlier, I mean, they're rich in essential nutrients. They ate, fat, they had at least 4 times water soluble vitamins, calcium, and other shellfish, organ meats, eggs, and animal fats. The very cholesterol rich foods that we're not supposed to eat. They had 10 times the fat soluble vitamins. And that's vitamins A and D. And there's so much of what we're told today is completely opposite of these native isolated diets that the people eat that are really healthy. They sleep great, they breathe great. When you read, Matt, you mentioned Matthew Walker earlier. He has studies that shows that if you sleep 8 hours or less, you have a much higher rate of cancer and other diseases. And if 8 hours or more, all those rates go way down. There are studies, this is amazing, daylight savings time. When we lose the hour of sleep, we get 24% increase in heart attacks that day. When we gain the hour back, there's a 21% decrease in heart attacks that day. But why do we have someone's making
It's
money on
amazing.
it because it's not healthy for anybody. Maybe the
It's
charcoal
not. Well,
company.
there's always talks that it's going to
What's that?
change. There's always talks it's going to change and stop, but I don't know if that's ever going to happen.
I had a patient yesterday. No, it was Wednesday. 35-year-old man had a heart attack. A heart attack at 35. And if you look at research statistically, from the heart attacks and strokes are going like this in 25 and 30 and 34-year-old people. They're increasing at an alarming rate. And it's all because of our diet. And actually, this is something that's really, really interesting, I think. I took this course in Houston called Dr. Bale and Doneen, and they practice in Portland. They're fabulous. It's someone that would be great probably for you to get on your podcast. And what they found is that the vast majority of heart attacks are caused because the cholesterol in your blood vessel walls leaks out and goes to your heart or your brain. You get a heart attack or stroke. So what they do is you do ultrasound scans of your carotids. You can do them of your aorta, your peripheral vessels. You can check everything. And they find people have the liquid cholesterol in their blood vessel walls. And if it squirts out, you have a real serious problem. But what they have found is certain statins in men and certain statin drugs in women calcify the cholesterol in the vessels. So it can't break out. Okay?
And that's why that supposedly helps.
And the man I saw the other day, when they scanned him, because he flew up to Portland, when they scanned him, his cholesterol was soft in his blood vessels. They immediately put him on a statin, which is going to lock him in the blood vessel wall. But in traditional medicine, I had to fight with my MD. I mean, I went to a private. There are these testing facilities. They drive around in a van and they go from a social hall at a church to a gym at a middle school all over all over the country. I know they're out of Texas, but I know they're in Southern California, and they'll spend 3-4 hours at each different place, and they go to a different place every day.
Mm-hmm.
And they test for all this.
Is this a CAC score? Because I've
The
talked.
CAC score,
Is
there's a
it the?
CAC score, and you can get a
Yeah.
carotid intermediate thickness, and they can test the age of your carotids and see how old they are. Like I have a friend of mine,
Yeah.
he's 70 something. His carotids, he's 35 years old, carotid artery wise. So he's really clean. I tested, I'm 75, and I tested, I was 59, my carotid artery age, which
Nice.
is fine. But the point is,
Yeah.
general medicine doesn't do these simple tests. Completely
Yeah.
non-invasive, and you find out what's going on, and then now you can go do your Western Price thing and really see if it's working for you. And everyone has a different thing. Everyone's body works differently. There's no one thing that works for every
Mm-hmm.
person. So doing tests like this and just more deep dive testing is really great because it makes each person an individual. And I have the same thing,
Well.
with what I do. We start off here, and I know I want to take you over here. But
Mm-hmm.
just like if you look at the back of a biology chapter or a chemistry chapter, the experiment, it goes boom, boom. But if something goes wrong, you're out here or you're out here. And very rarely do I have a patient that goes right, straight
Straight.
line, and there's
Yeah.
no issues. Everyone has these different problems, issues all the time. And that's what I'm here for, to troubleshoot the whole thing. But that's what everyone
Uh-huh.
is, no matter how similar the arch is, and how similar the biology is, and all the testing could be the same. Everyone will proceed at a different rate and in a different way. That you get the spaces in different places. All my spaces are like even through my whole mouth. Other people get gigantic spaces in different places, and it's just different for everybody.
Mm.
And I really believe that's why the tests you do to check your health, you really have to find the ones and make sure that everything is working for you. And actually, there was I don't know where I did it. I'll get it maybe the next time. There's something called
Mm.
AO something, and they test for it's like Chinese medicine-ish. And they say
Mm-hmm.
like eggplants are great for you, or avocados, but it may not be
Oh.
good for you. But
Yeah. Yeah.
98% it's good for. But if you're in the 2%, this testing lets you know what it is. So I'm a really big believer over the last couple of years in really checking everything, because things work for you and they're not going to work for the person that I see after you. And it's all everyone's an
Yeah.
individual.
Well, I think especially with the sleep test, I think everyone should get a sleep test,
100%.
and because you'll learn so much. It's like you said before, even when we talked yesterday, it's like if you don't test for it, you don't have it. Right? People,
That's
the doctors
medicine.
don't even know. It's like,
Yeah.
and then it just goes unnoticed. This is
Right.
the whole story with my parents.
Well,
They just had these problems. They went unnoticed.
it's like you can go to I'm pretty sure on my website, Gorman Health and Wellness, I think that's it. You can find
Yeah.
the adult and the kids Lamberg questionnaire, or you can go online and just Google Lamberg questionnaire, Lamberg, and they'll have all the different ones. Download or fill it out and see
Yeah.
if you have symptoms that highly relate to sleep breathing disorders. I think that's just a really, really simple way to start. It takes 5 minutes to fill the form out, and it's so informative. And what's amazing in his book that's great is,
Treat the airway, not the cause book. Yeah.
yeah, and
Or treat the
treat the
cause, treat the
cause, treat
airway.
the
Sorry.
airway. But it's like you'll go in, have you been diagnosed with COPD, asthma, or pulmonary hypertension? And when he discusses that in the chapter on pulmonology, he'll have all these studies that show that people with sleep breathing disorders have a much higher rate of these diseases than people that don't have a sleep breathing disorder.
Yeah.
So, and
What?
every disease is like that on the whole questionnaire.
It's so, yeah.
So he really did a fabulous, fabulous job putting everything together for people.
Yeah. I'm beginning to think, I talk about the diet stuff and it's like the root cause of most disease. Like most things have this dietary root.
Yeah.
And I feel like this is the second thing. It's the sleep is the root cause of so many things. I've talked about how seriously I take sleep, even if I'm not getting the perfect sleep yet, because I'm still on my journey of,
Right.
fixing my airways. I am in my bed 8.5 hours a night, no matter what.
Perfect.
I am doing it. I'm on it. But it's like the root cause of so much, it's sleep and it's diet. It's crazy
Well,
how much those two
you
things.
said, well, and lifestyle. So we have a
Well,
patient,
yes,
actually,
like,
she's coming in today after I finish with you, and she would hike around her neighborhood. I mean, I'm talking really hike. She's pretty far from me, so
yeah.
there's a lot of trails and everything. And she do 3 to 5 miles almost every day, grows all her own foods. And if she doesn't,
Mm,
she buys them from a guy someone that grows them naturally, and she cooks everything
yeah.
herself. Okay,
Yeah.
and she still had a sleep breathing disorder. So
Wow.
you need airway, you need jaw size and myofunctional. So you have diet, lifestyle, and then you have what I do, and that's the missing link. So you could do,
Yeah.
and the beauty is, and it's so wonderful, and I compliment her all the time. The diet and lifestyle are the two hardest things to do, because as soon as you walk out your door, everyone else isn't doing it.
Yeah. Oh,
Every
I know.
restaurant, you turn the TV on, all they're doing is advertising on healthy foods, for you to eat.
Yeah.
And so she's doing the two hardest things you could ever do. She's already doing
Mhm.
them. So okay, wear this appliance and turn it every 10 days. Okay, I mean it's like nothing for
It's
her
easy.
because
Yeah.
she's just so
Yeah.
focused and just is so motivated. And
You could do it in your sleep.
right,
It's so
exactly,
easy, you
do it in
could
your
do it in your
sleep.
sleep.
Exactly. Really
That's
that's a good
funny.
one.
It literally
That's
is.
great. That's a great phrase.
Yeah.
I love that.
It's the only one that's true that you actually can do in your sleep.
Yeah, yeah. But
Everything else is just a gimmick.
when you do any research online, and a lot of your followers, you found Weston Price. I mean,
Yeah.
if they found him, there's nothing they can't find. And the way it was
Yeah, they're
explained to me, he had his own Weston Price Society and newer members and whatever, and he had a newsletter, I'm pretty sure, and all that. And then something happened like in the 30s or 40s where he ended up selling his society to the American Dental Association. And they took all his stuff and they didn't destroy it. They just kind of put it in a room or a library, put it somewhere and just like stored it. And then someone
mhm.
came across it like 50 years later. Otherwise, it would still be, we won't even know about him. He was
Wow.
buried. And it's so terrible. And my dad, he always say, Martin, follow the money. you know, well,
Uh-huh.
with all the diseases that you get by not doing what he found in native isolated people
Yeah.
is medicine, processed food,
Yeah.
all that stuff generates money for people. And it's just really sad that everything that, no matter what direction we go in, there's like a lot of money being made. And wherever the most money is, that's where whether it's healthy or not, that's where
Yeah.
it goes. I mean, drug companies are advertising drugs on TV. I mean, seriously?
Uh-huh.
And the
We're
people
the
who
only
run
other
it,
country other than New Zealand that even allows
I
that.
can't, and the drug companies keep doing it, which means it's working. They're selling those drugs because people are going to the doctor says, I want this drug. And
Yep.
I don't,
Well,
I think it's
uh-huh.
horrible and we're completely heading in the wrong
Uh-huh.
direction. We have to go back 120, 30, 40 years and get healthy.
Yeah, yeah, I wanna go back to that because I saw that firsthand, what I brought up earlier about going to
Yeah,
Africa. So I remember, man, these people, they live in like a grass hut. Like it is serious, and so they're piled on top of each other. There's, the mom, the dad, there's like 6 kids. They're on a wooden stick bed that's just wooden sticks and a hide. and they're sleeping through the night. We were talking to them through our translator. They are conked out. They are piled on top of each other, and they can do that. And because they have the proper structure of their mouth, they're not snoring. They're sleeping through the night. They are healthy. They're eating only natural foods, right? Well,
Right,
sometimes they have
100%.
these like bags of corn flour that come in. I mean, it's getting bad, but generally they're eating their animal foods. They're getting the raw milk from their goat. That's all they have. They have,
Right, right, exactly.
and they can
And
sleep through the night. It's amazing.
absolutely. But they're healthy and they don't have a lot of, obviously, the things that we have, but everything we have comes at a price. And typically in that price is how many medications you on. I mean, the average 65 or 70-year-old person is taking like 7, 8, or 9 medications. I mean, you know,
Yeah.
and I know I admit it. I'm a carb junkie.
Uh-huh.
I cut way back in the last 4 or 5 years,
Uh-huh.
but it's hard. And but you can go, and my wife cooks really well, and she'll buy we'll buy like natural salmon and free range
Mhm.
chicken and all that kind of stuff, and we'll cook with the best oils and things like that. So it's way better, and everything still tastes great. I mean, but we try to stay
Yeah.
away from all the fried foods,
Yeah.
and we basically, well, my wife and kids cut out soda. I mean, they don't even go near it for the last 8, 10, 15 years. Me, I'll have maybe one a month just to get my fix. But
Uh-huh.
my wife and 3 kids, I mean, they just completely stay away from all that, and they cut way down on fried foods, way down on like French fries and stuff, certain breads and all that stuff we've gotten rid of, and it definitely better. I mean, I feel it in my digestive tract. I feel so much better. It's just not like bloated all the time. It's just amazing when you really cut out the bad
Yeah.
stuff.
Well,
Then
I think that's what people are doing listening, but this stuff is new to them probably. You showed me the success story you had. There's an older gentleman that allowed you to use his image, and it was really cool to see this facial structure change. Or
this
just tell people
gentleman,
more about some of your success stories with patients. Yeah.
he is, and what was amazing is we didn't show him his pictures when we took these, and we
Uh-huh.
showed him the third picture probably several months after we took them. And I just happened to, did we ever showed you your progress pictures? He says no, and he couldn't believe that this was him.
Wow.
He
Look,
couldn't
yeah,
believe
I'm
it.
gonna post this one. I
And he
gotta
goes,
post this one. This is
yeah,
crazy.
and he
Yeah.
says he sees I think just 2 kids, and he sees them both once a week, and he says
Uh-huh.
no one's ever said anything to me that I've
It's
changed.
just so slow. Yeah, it's so slow change.
It's
Yeah.
just such a
You don't
slow
notice it.
change. I mean, this is over 2.5 years.
Yeah.
He was 75 in the first picture and 76, 77. But it's amazing.
That
And
is amazing.
that's how we take the pictures, so we can see these changes. And everybody that we work on ends up with more symmetry. And, something very interesting. I forget what they call the process, but you take a picture and you cut it in half and you
Oh
double
yeah,
each
yeah.
side.
Yeah.
One side looks good and the other side looks horrific.
Uh-huh.
What we have found is the horrific side is the side of your head that didn't develop as well. So when
Mm.
we grow you and get symmetry with your upper and lower jaws and get everything as close as possible where it should be, and then we do the cut and double again, both pictures look good.
Wow.
So the
That makes sense.
underdeveloped
Yeah, you
side,
didn't develop
pardon?
fully developed. It's like the epigenetics stuff. It's like you didn't give yourself the right nutrition and lifestyle and
Right.
to develop your face properly. You had the genetics to
It's there.
have
The genetics is
proper
there.
structure, but you didn't do it. You didn't give it the right inputs.
Right. Now, I don't know if you can see this. When I smile, one side of
Uh-huh.
my smile is a larger black space and one has a smaller between the teeth and cheeks.
Uh,
This is smaller. This is larger. They're both about 50% small. So when I take more, for me to get symmetry with my upper jaw, I have to get rid of or make the black spaces equal or get rid of them completely. But
Mhm.
right now, my left side is more underdeveloped than my right. So if I did that split picture and doubled, my right side would look good, my left side wouldn't look good.
Mhm.
Okay? But the goal is to get symmetry, is to get the spaces completely gone, and then the tongue fits and everything just
Yeah.
lines up. And it's really amazing. And he is just
He's a
astounding. I mean,
well, you know,
he was speechless when he saw these pictures a couple of weeks ago.
yeah. Well, it's amazing you can get better looking. And,
Oh,
like,
for
you can
sure.
get a wider jaw. Like, you want like, I've seen these pictures for years. Some people show them, like, kinda dental people, or you show the mouth breathers, and you show the profile of the face too, and
Right.
they people just, like, look dumb, kind of. That it's like they got, like, the weird, like, chin and, like, the soft chin and, like, the
Yeah.
kind of protruding thing, and your face is skinny. Like, this is what modern people look like, and so people, even if you're not looking at images of this, you can picture that, right? The
Right.
back in the day, people had the wide face and they looked like good. They looked like real humans. This is what we used to look like.
Correct. I mean, there are studies. I'm looking for this picture, and
Here, well, while you look at it, I just remember Dr. Kate Shanahan's book too. She wrote Deep Nutrition. I've had her on my show. She's in the Food Lies film. She's amazing. She wrote about all the Weston Price stuff, all this stuff, and she wrote a lot about this epigenetic and like even beauty stuff of like looking good. Everyone wants to look good, and how if you give your body the correct inputs, you can look your best.
right,
And
100%. And this is another book, Jaws by Sandra Kahn, and she
mhm.
talks about Weston Price in here a bunch. But here you can look at just what you were talking about.
Yep, there it is.
There it
Yep, the kind
is.
of dumb look.
Yeah, that the healthy one has the airway and the sealed mouth and nasal breathing, and the one that doesn't has the bump in the nose like me, and the retruded jaw. It's all right there, and you see this time and time again. And she does a lot, and it's also this is also a very good book to read. It The Jaws and Breath by James
Yep.
Nestor, the two that are really written for the general population. Is very a little here and there that gets a little detailed, but the treat the cause, treat the airway is much more dense and more for healthcare professionals. But
Yep.
by reading it and just going through it, even skimming through it, you get the gist of the whole of what's going on. But those to me are the three best books. And well, of course, I hate this one because look at that kid, sleep wreck kids,
Oh
open
man,
mouth,
sleep
dark rings
wrecks
under the
kids.
eyes.
Yeah.
It's just horrible with the kids that, and so many of the pediatricians and MDs go, she will grow out of it. Just give it some time. And it may go
No.
away,
No.
but it always comes back. It's
So,
very sad.
speaking of kids, so that I don't think you're not going to be able to answer this question, and it's just sort of speculation. But I always like to think about this: what of it is the diet and nutrition to grow the proper jaw, and what of it is actually like chewing on foods? And Weston Price brought this up. Everyone's eating the soft foods or refined foods, and like kids used to eat meat. They used to chew on meat. The first food the parents would let them gnaw on little piece of meat, gnawing on bones. Like,
Right.
so you get the actual like uh, muscle development. So do you know if it's like, if there's any way to know if it's both, if it's one more than the other? Just a nutrition side of building a healthy jaw and palate, or is
I
it like
mean,
a physical side?
I think it's definitely both. I mean, you have to chew, like I mentioned with the caveman. We have jaws that are huge and all the teeth are worn down because they chewed. But so that's important. And then you need to, and the nutrition, I'm not sure that much, a lot of the nutrition goes into jaw, but it goes into all your organ systems. So it
Mhm.
helps, that's for sure. It gets in your body. But I think chewing one of the huge things. And we actually do an appliance for kids that it looks like a mini mouth guard. And the biggest thing the patient has to do is wear it, number one, obviously, but the other big thing is they have to chew on it. And you're supposed to chew on it 1 to 3 hours a day. Can you imagine trying to get like a 6-year-old to put this thing in and chew for 3 hours? And, you know, and one of the biggest negatives we have is parents today, you need to sit with the kid and do the myofunctional exercise. You got to sit with them for a time and do the chewing. They say, Jimmy, go to your room and chew on your appliance. Yeah, that's not going to happen.
Yeah.
You have to sit with them. And parents today really aren't into doing any of that. Very few people. I'm sure more of your listeners would do it. But the typical, you know, suburban housewife and husband aren't going to sit there for, you know, twice a day and do myofunctional exercise with their kids for 5 minutes. And it's 5 minutes. But the big thing today is here's your iPad and your laptop, and in the car are TVs, and they just don't want to hear from they want kids, but then they don't want to deal with them. Do what they have to do to, you know, to get them healthy and raise them in a nice way.
Well, it's also they've just been scared away from eating meat too. It's like
exactly.
Kids we all grew up gnawing on meat. Red meat is a health food.
I mean, and even Weston Price, he said, you know, everything was that all these native people eat in their diet, we're told is bad for us.
Yeah.
But sugar's good.
Opposite world.
But sugar's good.
It's insane. People, it's opposite world. I know.
It's opposite. I mean, they tell us everything is carbs and sugar, but don't eat meat. Excuse me? This is the biggest carbs and sugar, the biggest crap you can get your hands on. And okay, it's just so opposite.
It's crazy.
And it's really sad that, and I mean, just look around when you walk in a mall. How many people are huge? Yeah. And it's not even embarrassing anymore, sadly. They were all wearing tight clothes. It's like not wearing like something big so you can't. They wear something tight. You can see every fold. I said, I don't know how anyone finds that appealing. It's sad. And, you know, when I was growing up, you know, John F. Kennedy was president, and he had this whole physical fitness thing they put in the 60s. Well, now that it's 60 years later, there's none of it. We had the Surgeon General. I don't know who the one is now, but when President Obama was president, he had the Surgeon General, and a very smart, very bright lady and all, but she was 20, 25 pounds overweight, and she came from a state in the South that's like the second least healthiest state in the country. Well, how do you put someone in charge of healthcare in the country, basically, that's out of shape, and the state she came from is horrible? And but it's all okay. Everything's okay. And it's just not. It's just not. It's just not okay. And we can't expect the government to do anything. This is really, sadly, is really an individual or small group endeavor. And we just have to just plug away and punch away at it. And that's why
it's so true.
And that's why when I get patients, I have more patients from outside my area by far than my local region.
Yeah. Well, that's good. Yeah. Oh, people. Well, yeah. So true. So true. Whatever comes from on high is just to, like, you know, is good for the corporations and good for control. And you need to do the opposite, which is usually better for the individual, right? So that's why I say it's the opposite world. Well, whatever they say from on high is usually good for the group. You know what I mean? Not good for the group, good for them or controlling the group. What's good for the individual, opposite is for your own health,
Correct.
Individual health.
Correct.
And I'm glad, people can work with you all over the country. You don't have, like, I mean, I just happened to be in LA twice, and we took care of my appointments while I was in LA. So that was really great. So, oh, wait, there's one thing. So, but yeah, I just want to make sure people know that you can work with Dr. Gorman, even if you don't live in Los Angeles. But we wanted to talk about females and their sleep apnea. Right. Yeah. And their hormones.
Right. Yeah. great topic to go on. We have just so many people we treat and see that were young, either are young, healthy females in age, or they're in their 40s or 50s, and they were young, healthy females, and they're still thin, trim, they look good, they take care of themselves, and they have really terrible sleep and breathing issues. And the big issue is that female hormones, estrogen and progesterone, protect the females from having apneic events. So they don't have anything that's really serious. So as teenagers, men start getting sleep apnea, and our percentages are up here. Women are down here. But as women age and they start getting closer to premenopause and menopause, they start losing their hormones. And when that happens, their apneic events jump up to within like 3% of men. And you can ask any women, literally 99% of them are going to say, I had all these little problems and blah, 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 blah growing up. And then all of a sudden, when I started getting to menopause, my sleep went to hell and everything really went south. It was really terrible. And we see this all the time. So a typical sleep test of a female is they have some apneic events, but they have more resisted breathing, like this noisy breathing. They have more events that are less than 10 seconds. They have pretty decent REM, but very poor deep sleep. It's just literally every female patient we see is like that. Now, if someone comes in that's really overweight, yeah, then they'll have issues earlier on. But if you're in basically good health and you trim-ish, maybe 5, 10, 12, 15 pounds overweight, you can have little or nothing going on, and they'll have symptoms. I've had a couple people, they check off the Lamberg questionnaire, they 2 boxes. And the arch was like, I mean, they were like this big, narrow.
Mm-hmm.
And, but they understood what was going on and they knew, and thank God this woman was a trainer, and she ran track in college and everything, and she went through the process. But the vast majority of people are checking, women, young, are checking off 8, 10, 12, 15 items on the questionnaire. So they have all these symptoms that are highly related to sleep and breathing, and nothing's being done for them. And they just know
Well, it's
when I talk
because,
to
so just
them,
make that
when I
clear.
educate them, it's like the light bulb goes on, and they know that they need what we're doing.
Well, so to be clear, you're saying they can check off 8 to 12 boxes on the
And
sleep
and and, and,
of
and,
the
if you,
symptoms, but then get a decent sleep test,
and
right?
the
So they
sleep
don't
test
know. So this is like this
and the
undiagnosed
sleep
problem.
test doesn't show much. And what's
Yes.
happened is in the last handful of months, Medicare has gone from a 3% drop in oxygen for 10 seconds or more to be an apneic event to 4% drop in oxygen to qualify. So literally every single person that was
Whoa.
mild and moderate sleep apnea doesn't have apnea anymore. They don't have.
Because they just changed the
They
goalposts.
move the
Yeah.
goalpost. It's unbelievable, and that was to save money. And then every
Oh,
insurance company, every
wow.
private insurance company is following the 3% to 4%. And the only people that really get events to a fairly high degree at 4% drop are the severe apneics. So if you have mild to moderate, you'll have 12, 15 events at 3%, and at 4%, you'll have 2 or 3, and you have to be over 5. So they're gone. So the insurance doesn't have to pay for them. But if you have severe apnea, you still qualify. But it's just
That's
like
crazy. Oh.
they just move the goalposts. They keep changing everything, so they pay out less money. Medicare can't afford to pay out,
Oh my God.
so they change it. And when Medicare makes a change that's good for the insurance companies, they can't run fast enough to follow. If Medicare did something that would cost the
Oh,
insurance company money, they wouldn't do a thing. But they're going to make a
yeah.
lot more money now. So anyway, it's very alarming, and I haven't had the vast majority of the patients that come here to see me have mild and moderate sleep apnea. especially the females. And I haven't had a female that's qualified at 4% drop in oxygen in the last ever. And how can you
Well,
check off all these symptoms and have all these diseases and problems, but you're healthy? Because again, like I said, if you don't test for it, you don't have it. And it's very, very sad the direction healthcare is going. It's already there, actually. It's just going
it's well,
farther
it's
away.
already there. People know that. People listening know that, but I'm glad we woke people up about this whole dental side, airway side, sleep
Right,
side. It's huge. It's huge, and I mean, I didn't notice it either. Like I was just
right.
one of the
No,
people. I thought I was doing it all right, and there's this whole other
right,
rabbit hole and it's, and I can already tell it's helping. I can tell my jaw's
right,
getting wider. Like you want that, like as guys, you want that big strong
right.
jaw. I can see it.
One
It's
thing I just want to
changing.
add about women, I had one patient that took hormone replacement when she was in menopause, and her sleep issues that she had had prior to take the hormone replacement skyrocketed. Her sleep went really bad. She took the hormone
Mm.
replacement, everything really, really, really improved. So she stayed on it, and I can't remember what reason she did. She told me, but she stopped taking the hormone replacement for some reason, and her sleep went to crap again, and she couldn't
Mm.
get back on the hormone replacement fast enough. Yeah, so
Wow.
and we don't know why and how the mechanism works, but this is what we see. But we don't know why it's
Yeah.
happening, what the
Yeah. Yeah.
hormones
Yeah.
are doing specifically to help women. But it's but like I said, if you ask any women that have gone through menopause, 99.9% of them are going to tell you exactly what I said. Their sleep really got bad, and all the symptoms got way, way, way worse when they went through menopause.
Yeah. Well, thanks for coming on.
You welcome.
You have a website, mgormandental.com. Is that what it is?
I think it's that and or Gorman Health and Wellness.
Yep. Gorman
Yeah,
Health and Wellness. You can find him, Marty Gorman. Just look him up on Google. This is
yeah.
great stuff. Yeah, I mean, this is an investment in your life, right? It's going to take a while, but it's an investment that I am absolutely just so interested in making. So,
Oh my God! I mean, the change in just waking up in the morning, how you feel once it really starts kicking in, is absolutely amazing.
well, it's priceless. If you can
Yeah, no,
fix that, the rest of
yeah,
your life is better.
100%. And it changes everything. Like I said, when we give back the health history forms to the patients once a year to cross off the symptoms how long they have, everyone's crossing off symptoms. So everyone is feeling better, and whether it's a complete absence of those symptoms or it's just a really nice increase in the symptom going away. And we've had patients, get off blood pressure medication, that are off their cholesterol medication. Everything is just changing for them, and they're just more awake. And just the physical appearance, of, like the one patient I showed, is just amazing. And his whole life is changed.
All right. Well, go see Dr. Marty. Thanks so
Thank you.
much. And I'll see you soon in LA next time I'm there.
You got it. All right. Stay well, and thanks so much for having me on.